Okay, so we're going live in 3, 2, you're live.
Hello guys, it's Dr. Vidal and we are here at Pure Plastic Surgery with Tuesday Tips. We meet every Tuesday afternoon to discuss different topics of plastic surgery and I get to answer your questions. And today we are talking about a different topic because of this recent post. I don't know if you guys saw it in my Instagram, but it got a lot of attention because a lot of people didn't know that I do facial surgeries. So let's talk about the facial surgeries that I do and I get them to answer questions. This beautiful, beautiful patient of mine, and thank you for answering a lot of the questions in the post. So she got an upper lip lift. It is not a lip flip. And I'll discuss what's the difference between those two, but basically a lip lift and chin and lipo and face tight to the chin. Okay, so let's start talking about an upper lip lift. Okay, you can see how the distance between the nose and the upper lip is very long in her case. Okay, this is genetic because she's not old, she's in her early 30s, so this is just genetically like that. But with aging, this is a common thing that happens, that this length increases, making the upper lip look thinner. Why? Because as this distance increases, the upper lip tends to kind of turn inward, so the juicy part of the lip, it's on the inside. So she wanted more fullness in her lips and she went to an injector back where she is home, okay, near to her house. This injector put hyaluronic acid fillers and she didn't see much of a difference. She's like, I still don't see that plumpness that I'm looking for. And because she went to a very well-studied and knowledgeable injector, that person told her, I think the problem is not that your lip needs more filler, it's that you need a lift. When we remove that excess skin on the top, pull this upwards, that brings the lip out and plumps the lip. And you can see this is only 6 weeks apart, okay? You can see this distance, how it changed, longer here and shorter here, and that turns the lip, the upper lip outward, creating more volume. She did not put any filler in between this picture and this picture. This is all by lifting the lip, okay? Where is the incision? So right there, okay? It's an incision that if you treat it very well, and you have to be, I'm very, very meticulous with all my incisions, but with this one, I am extra meticulous, okay? The handling of the tissue, the sutures that I put, very thin, very careful to try to avoid a scar that is more noticeable, okay? And very diligently at 2 weeks post-op, our Silogen or silicone-based scar product, very on top of it. And this is only 6 weeks apart, okay? So I did a little drawing here, that where you see the red line, a beautiful drawing that Willie is making fun of me. That's where the scar hides, okay? So if you are experiencing this, then that can change the face a lot because it rejuvenates the face a lot. And the upper lip lift is different than the flip. You guys have heard in social media about the upper lip flip, and that is with neurotoxin. That is Botox to the muscle around our mouth to create an illusion that the muscle is a little bit thinner because we paralyzed it, and it flips the lip a little bit, but it does not change the distance, okay? Because it's not an excision like the lift, okay? That's the difference. So she got an upper lip lift, 6 weeks apart, and I'll show you guys the side view because I think the side view shows a lot of what I was mentioning of the tissue of the lip, okay? very thin upper lip and the distance here, and you can see in the post-op, shortening that distance, pulling that upper lip, and bringing that tissue of the lip out, creating more plumpness, okay? This is a procedure that it can be combined with other procedures, okay? So one of the questions that I saw in the comments is, can I combine it with a mommy makeover? Yes, but not everyone is a candidate for this procedure, okay? I'll have to evaluate your particular case, because that distance and you're smiling, it's going to determine if you're going to see results, if it's going to be a good procedure. Because if this distance is not long and we do this and shorten it, then you're going to be showing teeth even when you're at rest. You're going to be like this, and that doesn't look good, okay? So it has to be for a good candidate, and she was a perfect candidate for this procedure, okay? The other procedure she got, and I'll jump to the chin lipo because I'm talking about her case, and then I'll go back to the rest of the procedures, is the chin lipo and face tight. So she wanted to get rid of that double chin and define more the jawline, okay? So you can see she had a more what's called obtuse angle. So this angle, not sharper, so a little bit more obtuse, and then no definition of the jawline. So we went ahead, we did a, right here, okay.
Thank you.
So we did chin lipo, which is just a small incision in the crease here of the chin, tiny incision like this, and basically emptying the fat below the skin above the muscle in all this area to define her jawline. What is face tight? Face tight is radio frequency energy that I do it in combination with the liposuction for skin tightening. Okay, the shin skin is an area that the skin is very thin and it doesn't contract as well as other areas of the body. So chin lipo only has to be a very young patient in their 20s with very good quality skin. Otherwise, I recommend adding face tight, because that skin elasticity is not gonna retract, and then it's gonna look like loose skin here in the center, deflated, and that looks worse than this, okay? So face tight, radio frequency energy, same incision at the time of the liposuction for skin tightening. This is only 6 weeks apart, and you can see the major difference in her jawline, and face tight continues to retract the skin up to 6 months after surgery. So I have a lot of patients that had the face tight recently, and they're like, I still see loose skin. Well, one of the things is you have to give it time, okay? The radio frequency takes time with collagen formation, skin retraction, and takes up to 6 months to see a final result. And the other thing is you need to be a good candidate for the face tight, okay? More skin elasticity, that you have more wrinkles in the neck, that the patient is older, the skin is not going to retract as well, okay? So face tight may help in younger patients with mild to moderate skin elasticity, but if we have already severe skin elasticity, especially massive weight loss patients, for example, those patients will benefit from a neck lift, a surgical removal of that skin and pulling it up, because face tight, you may not see dramatic results with it. She, again, was a perfect candidate because she had that excess fat, but not loose skin. The skin was thick. She was, like I mentioned, in the early 30s, so that skin was very good quality, and she had very good results getting a sharper angle, more definition of the jawline, and emptying all that double chin area, okay? So when to do a neck lift or a face lift, then that's gonna depend on the severity of the skin elasticity. If you have severe skin elasticity, then a neck lift is better. What is a neck lift? The incision goes behind the ear and it hides in the hair, and a small incision hidden where the chin fold is. And basically, it's emptying all that fat, pulling that excess skin, and we have a muscle in our neck called the platysma, and sometimes that muscle with aging weight changes separates, like the muscle in the belly, and we plicate it the same way that I plicate the muscles in the belly, bringing it together. plicated this muscle here, the platysma, to get a sharper angle and more definition of the jawline, okay? Who's a good candidate for a neck lift? Younger patients that had severe skin laxity. If you are in the older range, more than 40, then the problem with a neck lift is, if you do not address the face, is that you're gonna have a good definition of the jawline and the jowls or the tissue of the face may be sagging and you're gonna notice it more. So a lot of times when I have patients that come that are in their 40s, late 40s, 50s, and they're like, I just don't like my neck. I'm okay with my face, but I don't like my neck. The problem with fixing the neck at that age and not addressing the face is you don't have problems with your face now, but when I fix your neck and I have all this tightened up, you're gonna notice the sagginess in your cheeks that you didn't notice at first, okay? So most of the time, if you're in the late 40s to 50s and you want to improve the neck, it's better to do a full facelift to improve that. So what's a facelift? Facelift addresses the entire lower 2/3 of the face and neck. Same facelift includes a neck lift, okay? The incision of a facelift goes in the hairline here, then in just anterior to the ear, but it's blended in where the face skin meets the ear skin. So that incision heals very, very nicely. And then it curves in the inferior part of the earlobe back to the ear, and then the same incision that I explained for the neck lift. The posterior part of the ear, and it blends on the scalp, and small incision here. What does it involve? I put the deep plane because a lot of people on social media are talking about the deep plane facelift. What does this mean? So facelift surgery has changed in the past 30 years a lot, and now we have understood how the importance of the facelift is not pulling the skin, because that's what makes a facelift look fake or pulled. You don't pull the skin. What you do is you reposition the deep structures of the face. That's why the deep plane is important. So we have tissue in our face, fat, muscle, that with aging it descends, and then it makes your lower third of the face be fuller, and this is deflated, the top part of the cheek part. So what you do with a deep plane facelift is reposition all that soft tissue that descend, and it's making the jowls and these lines more prominent, basically repositioning up to reestablish that youthful, fuller mid face, flattens or deflates the lower face, and brings the face from a more square to a more V shape, okay? Repositioning back those soft tissues in the upper cheeks, bringing this thinner and making the face look thinner and more youthful, okay? And because it readdresses the lower face, and the incision extends to the neck, it is the same type of neck lift that I just described. Getting rid of that excess skin and fat in the neck, repositioning or repairing that muscle to create a sharper angle in your neck, and getting rid of that excess skin. But the point of the deep plane, it's not to tighten the skin, is to reposition the soft tissue of the neck, and that's the most important part. The facelift can be combined with an upper lip lift if you have that, because like I mentioned, with aging is very common that we have an elongation of that upper lip length. So it can be combined to recreate that, to match that youthfulness in the cheeks, in the upper lip, and the blepharoplasty or the eyelid surgery. So eyelid surgery, very, very strong surgery to brighten and rejuvenate the upper part of the face, because with the facelift we get from cheek down, okay? The eyes, that's the blepharoplasty, and we can do upper and or lower blepharoplasty to target basically two things. One is excess skin, and that makes the wrinkles around our eyes, and the second one is the puffiness. So there's fat that bulges or herniates kind of bulges, and that's why you see with the double bag that you see under your eyes, that bulging, that's excess fat. So a combination of lifting that fat, repositioning, removing some of that, and then tightening the skin around the eye and rejuvenates the eye a lot, okay? And the other face surgery that I do very commonly is a rhinoplasty, and you guys are gonna be seeing one this week because I'm doing one tomorrow, so I'm gonna be talking about that the following days of the week, okay? So rhinoplasty, the most common two things that we fix with it is the dorsum and the tip. But there are other things that we can fix, like the ala, and also breathing problems. So if you have a deviated septum and you have breathing problems, that can be fixed at the same time of the rhinoplasty, because I use that cartilage to fix the dorsum and the tip. So if you do have breathing problems, it's something that we can do. Okay, I'll open it up for some questions if you guys have.
Yes, we have this one. It's about the topic. So
yes.
Going with this first.
Okay. Can
we combine the upper lip lift with blepharoplasty and neck lift?
Yes, definitely. All those things can be combined, depending on your age and what is it that you need. I can give you an evaluation and determine if you need a full facelift or just a neck lift, and combine it with blepharoplasty, upper lip lift, and do a full facial rejuvenation.
How's the process of breast implant downsizing?
So downsizing a breast implant, I'll have to evaluate your particular case, because most of the time, depending on how much you want to downsize, you may need a breast lift, okay? So why? That implant is creating volume, expanding the skin. I put a smaller implant, then that excess skin is gonna sag. So most of the time when we're downsizing, I have to do a lift to tighten everything and reposition the position of the nipple.
Okay, let's go to the next one. Can I get information about round 2 BBL, please?
Of course. So round 2 BBLs, I do them fairly commonly. It all depends on your goals and expectations. Most of it, and if you have fat available, because I think that's one of the most important things about a round 2. If you weren't a very high BMI patient and you already had a Lipo360 for a BBL, you may not have a lot. So I'll have to evaluate your case. So easiest way, go to my page, and the link in bio has a virtual consultation form. Ask you a couple of questions, to send pictures. I get to evaluate all of that and determine if you're a good candidate, and a coordinator will be in contact.
Okay, waiting time after round 1 to the round 2 BBL.
Okay, I usually recommend at least 9 months. A year is even better. So it's because I want the lipo areas, that scar tissue that forms initially, to soften up so I can re-lipo those areas.
Will Vaser lipo alone tighten chin?
The chin, yes, we can do Vaser on the chin. Depends on the amount of fat. So Vaser for the chin is more for more fatty chins. If you don't have a lot of fat and it's mainly skin, then maybe face that will be a better device for you, okay? But definitely that is an option. If you're having Vaser lipo in other areas, we can do Vaser to a chin.
Is there any special care after face tight needed, such as facial massages or any sound sensitivity?
Okay, so yes, on the post-op. So face tight or body tight. Body tight is the same as face tight, but the cannula is longer for the body. So we use it in the belly, arms, thighs, other areas of the body. So the post-op is the same as lipo. So you will require massages, you will require compression to try to get that skin to retract, okay? Changes in sensation is always a possibility, even after lipo, but with energy devices the risk is a little bit higher, but it is all temporarily, and it returns back to normal. It just takes a couple of weeks to months.
Okay. Will vacuum therapy on the butt help with the skin laxity before a BBL procedure?
The what therapy, sorry?
Vacuum?
Vacuum therapy.
Yeah, vacuum
So vacuum
therapy.
therapy is basically like putting cups and creating suction to the skin to kind of stretch the skin. I have not seen very long-term results that actually change. I think mainly that vacuum therapy works temporarily. Like you see an expansion initially, but then after you remove that suction, give it a couple of hours and it returns back to normal. I don't think that it has a very long-term effect. So I haven't seen a very big change for the skin elasticity. And you have to be careful because, you know, you want the skin to kind of be more elastic so we can inject more fat, but you don't want it to be drooping, right? So be careful with those vacuum therapies. That's it, you guys. Hopefully this helped answer a lot of the questions. Is like, you do facial surgery, what is that? What you got done? Filler, lift, flip, what is it? So this is basically the facial surgeries that I perform. So if you want an evaluation, more than happy to evaluate your case. The virtual consultation form is the easiest way. And I'll see you guys next Tuesday. There was one question about talking about round 2 BBL, so I can do Tuesday tips next week about round 2 BBLs and what are the requirements, what to look for and all of that. Okay, so I'll see you guys. Willie, something?
Yes, an important question.
Okay.
Last minute question.
You're like, no, okay.
No. Let's have this because this is the second time as here at TikTok, because
Okay.
now we're live at TikTok.
Okay,
Can
sure.
someone with a history of DVTS, pulmonary embolism, that happened at random get a BBL lipo 360?
So the problem with that is that it makes you a high risk for developing another DVT-PE, not at random, induced because of the surgery. So if you had a DVT-PE at random, means that you are very high risk to have it with surgery, that it increases the normal risk for a DVT-PE. So I do not recommend it because DVT-PEs can be fatal. So it's something that we shouldn't, play with it because it is in a lot of times so fast that it goes straight to being fatal without any time for an intervention. So I do not recommend it, sorry. Okay, you guys. See you guys next Tuesday. Tuesday tips. I'll announce it. I'll announce the time later on. Have a beautiful week.